Charlotte Pecot, and I'm a fourth-year medical student at Tulane University School of Medicine. And today I'll be discussing our project on the American Academy of Orthopedic Surgeons clinical practice guidelines on carpal tunnel syndrome. The aim of this study was to analyze and compare characteristics of the included studies that were referenced within the original and updated carpal tunnel syndrome CPGs to determine whether level of evidence and various characteristics had changed or improved over the updated version. Manuscripts of included studies were reviewed to analyze level of evidence, data publication, journal publication, country of origin, and funding status. We then used t-tests and chi-squared tests to compare variables between different versions of the CPGs. And in the bottom left here, you can see a representative rating scale of a system of level of evidence that was used by our raters. In terms of results, we found no significant difference in the mean level of evidence or proportion of high quality studies, which we defined as level of evidence 1 or 2, between the original and updated CPG versions. There was also no significant difference found between the CPGs in terms of studies that were based outside of the United States or that had domestic funding sources. There was a statistically significant difference found in the number of studies that were published within 5 years of inclusion in the CPG, with 60.8% of the original CPG sources published within 5 years compared to 30.1% of the updated version. This difference was also reflected in the mean time from study publication to inclusion within the CPG, which averaged 7.12 years in the 2008 version versus 10.71 years in the 2016 version. We also found that studies included in the original clinical practice guideline were more often published within hand-specific journals as compared to the updated version. So in conclusion, our findings suggest that the included studies supporting the updated clinical practice guideline on carpal tunnel syndrome were on average older and included fewer studies published within 5 years of the guidelines publication as compared to the original 2008 version. This could suggest a limited availability of recently published studies that are high quality and well-funded that could be used to drive changes in future research and practice. So some of our next steps include analysis of clinical practice guidelines on different upper extremity pathologies and comparing these in order to guide funding and research efforts towards certain pathologies that would benefit the most from additional studies. Does that make sense? Any questions?
Perfect. Thanks, Charlotte. Question I have for you would just be, what made you look into carpal tunnel syndrome specifically versus guidelines on other orthopedic topics?
So we are currently looking into other orthopedic topics. We're also looking at distal radius fracture as well as some shoulder pathologies. As for now, this was the most complete data set that we had gone through by our data collectors. But I think our next steps will be comparing the carpal tunnel changes with the updates against, for example, the distal radius fractures and seeing where certain pathologies could use more funding or more recently published research.